Hi, folks. Welcome today to our webinar on opportunities and challenges for dietary assessment in Oceania. I'm Associate Professor Tracy McCaffrey, and I was being tasked to lead the Dietary Assessment Task Force, and no better way to start our Talanoa than with this webinar. And I would like to invite Josephine. Would you please provide us with a blessing, if you don't mind?
Great. Thank you, Tracy, and welcome everyone. I will say a word of prayer before we start our webinar. Dear Heavenly Father, we come before you today with grateful hearts as we gather for this webinar. Thank you for the opportunity to learn, share, and celebrate in ways that will make a positive impact. We ask for your wisdom and guidance as we discuss important issues, that our words may be insightful and our intention will be guided for our good. Bless each participant with clarity of thought and open hearts to receive and contribute meaningfully. May this session be fruitful, inspiring, and lead to a positive change. We place this gathering in your hands, trusting in your grace and wisdom. Amen.
Amen. Thank you so much, Josephine. And again, I would like to acknowledge that I'm coming to you from the lands of the Wurundjeri people of the Kulin Nations, and acknowledge that all of our First Nations people have a continuing connection to the land, waters, and seas on which they live and we work and operate. And to take this moment in time to actually think about what it means from all of the different perspectives around the Oceania, and how the challenges and opportunities that we have as nutritionists and dietitians, public health nutritionists as well, to understand how we can actually work together to support the health of our region. I also want to start off with an acknowledgement, given that I'm from a background of dietary assessment and that there is no one perfect method. And I have taken these 4 statements from a number of eminent experts in our region. And I really want to the spirit of these statements forward today. We do know that there are challenges. We do know that we're relying on individuals to accurately report what they're eating, but also that we do have those inherent biases then that comes with self-reported data. And that also that we have a new number of different dietary assessment methods that we can use, and that there's no one perfect answer, but it must be fit for purpose. And so that is tailored for each of the research questions or policy assessments that needs to be undertaken. And that, again, participant burden, I think for me, is something that I'm particularly interested in and mindful of. So if you don't know these papers, I would certainly go and have a look at them. So today we've had our welcome and introduction, but I also want to share with you a little bit about FONS, the Federation of Oceanic Nutrition Societies. We're going to then hear from our expert panel. We've got Salome and Jessica hearing about the perspectives of UNICEF and DFAT. Then we've got a Talanoa where we have the opportunity to discuss some questions and bring our ideas together so that we can develop a pathway forward for this task force. And then we'll have a discussion and feedback from all of you. And of course, given that I'm an educator at a university here in Melbourne at Monash, I've got a link to a page where I want you all to put some thoughts and help me gather those insights from your breakout groups. And we'll have the closing and next step summary as well, because we do want to continue this dietary assessment task force and we've started planning the next steps. I will just stop sharing and I'm going to invite Salome. Thank you so much.
All right. Thank you very much, Tracy, for the introduction. So yes, I'll be presenting on how UNICEF Pacific uses dietary data to inform its child and maternal nutrition programs. So the Big Island countries and territories face a triple burden of malnutrition. Overweight and obesity rates are alarmingly increasing across all population groups, including children and adults. While nutrition and micronutrient deficiency still continues to persist, optimal diets are conceptually or the main key in immediate driver
for malnutrition in all forms, including overweight and obesity. In the Pacific, as you can see in these two figures, there are uneven progress in the Pacific, which is also reflected in the Sustainable Development Goals for children and maternal health. So maternal and child nutrition data is uneven across all the Big Island countries, and there are gaps that exist even for certain nutritional condition and age. And as you can see on these two figures, the forms of malnutrition in under fives is only available in certain countries and not all countries. And also, as you can see on the maternal mortality and child mortality, not all countries, they have achieved the SDG targets. That's one of the main characteristics of nutrition data in the Pacific, that malnutrition and nutrition data are uneven across the island countries. So I think it's important to understand what UNICEF is doing across in the Pacific Island countries. So UNICEF supports the Ministry of Health in 40 Pacific Island countries. These countries include Cook Islands, Federated State of Micronesia, Fiji, Kiribati, Marshall Islands, Nauru, Niue, Palau, Samoa, Solomon Islands, Tokelau, Tuvalu, and Vanuatu. In implementing multi-sectoral nutrition plans, addressing policy, regulatory, and capacity buildings, efforts to improve nutrition services and dietary outcomes. UNICEF Pacific promotes the rights and well-being of every child in the 14 Pacific Island countries and territories, which are home to around 1.3 million children and youths living on more than 660 islands and atolls, covering around 17.2 million square kilometers of the Pacific Ocean. UNICEF works with partners to strengthen health systems, expand immunization coverage, and support policies and financing to protect the health of children and women. Specifically, UNICEF works with Ministry of Health to implement quality, high-impact nutrition interventions, such as breastfeeding, complementary feeding, micronutrient supplementation, and deworming. UNICEF implement multi-sectoral nutrition plan addressing policy, like I've already mentioned earlier as well already, and also preventing child infections through immunization and health promotion, core elements of nutrition of UNICEF work, and is complemented with early detection and treatment of infection. The newborn period is when a child is at its most vulnerable. So UNICEF offers Ministry of Health to improve newborn care, including prevention, management of hypothermia, food care, resuscitation is critical to improve newborn survival. In terms of dietary data sources, I would like to bring this to Solomon Islands. This is where I have experience. In Solomon Islands, most of the dietary data sources are from the Solomon Islands Demographic Health Survey. 2015 is the most recent. The Solomon Islands Demographic Health Survey collected comprehensive data on various aspects of health and nutrition. While the food report provides detailed information, the key dietary data collected include anthropometric measurements, blood pressure and hemoglobin levels, dietary diversity scores, food consumption patterns. For the Household Income Expenditure Survey, the latest one was in 2012 to 2013. It was led by the National Statistics Office and aimed to collect comprehensive data on household income, consumption pattern, and living standards. The Ministry of Health and Medical Services in the Solomon Islands utilizes the District Health Information System. It is an open source software platform designed for health information management. And this is one of the data sources that we can also help to use in program planning and design. The last Solomon Islands National Nutrition Survey was conducted in 1989. It was aimed to assess the nutrition status of the population, while specific details about the dietary data were collected are not readily available at the moment because of the long expiry of this data. The survey actually gathered information on food consumption patterns, nutrition intake, dietary diversity, and meal frequency. The most recent one that was introduced by UNICEF in the Pacific Island countries, it's called the Multi-Pole Indicators Cluster Survey. It gathered information on well-being of children and women. And this has already been conducted in Kiribati, Tonga, Samoa, Tuvalu, Fiji, and Nauru. Nauru has just launched their mixed survey in November 2024. And also the same, it also provides valuable insights into the status of women and children. And this survey is part of a global initiative developed and supported by UNICEF, aimed to provide internationally comparable data on key indicators to the welfare of women and children. And the mixed survey also provided data for about 42 of the SDGs targets. Now, we're just going to mention some of the ways that UNICEF program in Solomon Islands we use data to strengthen the maternal and child health programs. In terms of maternal and nutrition policy and programs, data is used to guide the National Food Safety, Food Security and Nutrition Policy 2024 to 2029, and also inform the Solomon Islands food-based dietary guidelines. The second ways that was used was including improving infant and young child feeding practices. The dietary data also informed the development and implementation of the high-impact nutrition intervention guidelines and training manuals in 2018. Thirdly, identification of nutrition deficiency, implementation of food fortification in flour and rice in Solomon Islands, and iodization of salt, and also home fortification with micronutrient powder. The identification of nutrition deficiency dietary data helps to pinpoint common deficiencies such as low iron intake, leading to anemia in pregnant women and young children, as well as poor complementary feeding practices. The dietary data is also utilized in enhancing food security and sustainable diets. The UNICEF collaborates with stakeholders to improve locally grown, nutritious foods and reduce reliance on imported, ultra-processed foods that contribute to obesity and diet-related diseases. For example, it informed the development and implementation of taxation of certain sugary beverages, also informed the school meal program for Solomon Islands. This is a new program. It's just starting this year in 2025, and also informs the food basket guidelines for food ration for emergency response. Food basket for food basket for emergency response in terms of nutrition in emergencies. UNICEF partnership with Ministry of Agriculture and Livestock, and also in collaboration with Ministry of Education and Human Resources and Ministry of Health and Medical Services for the school meal program. The data also helps in terms of monitoring and in evaluating nutrition programs. Continuous data collection allows UNICEF to assess the impact of interventions such as vitamin A supplementation, deworming, and food fortification efforts, and adjust the strategies accordingly. Next, we're going to move on to the challenges. These are, next slide, please. Thank you. So these are the challenges, a few of the challenges that I could think of. The quality and availability and consistency of data differ significantly between regions within the Pacific Islands. Maternal and child nutrition data across the Pacific Island, as I mentioned earlier, is inconsistent, with gaps in specific nutrition conditions and age groups. There are variations in data collection and resource limitation hinder comprehensive monitoring, affecting targeted intervention and policy development. These gaps limit the ability to assess malnutrition, nutrition deficiencies, and obesity, making it challenges to challenging to implement effective nutrition programs. The other important challenge is capacity and time. Dietary intake assessment requires dedicated human resource and also those possessing specific technical backgrounds and experience. The current UNICEF Pacific Health and Nutrition team does not have the prerequisite expertise or time to dedicate for this work. Finance and logistics is also another big challenge because of the high cost of national nutrition surveys or dietary assessment surveys. It affects the frequency of having or conducting national nutrition surveys. Now, we're going to look at the opportunities that is with dietary data. For in 2023 to 2027, nutrition program for UNICEF focuses on multi-systems and multi-stakeholders approach to deliver diets, services, and improve practices for optimal nutrition at every stage of life, while sustaining responsive nutrition development for all children, adults, and women. UNICEF's program uses a systems approach across 5 key areas. They have food, health, water and sanitation, education, and social protection. With social policy, UNICEF will focus on improving nutrition data and evidence through the mix, follow-up survey, and public financing for nutrition. This includes nutrition-sensitive social protection policies, programs, and strategies like CAS Plus social protection programs targeting 1,000 days and humanitarian cash transfer. In the Solomon Islands, the opportunities are present with a mix that will be happening in 2026. So as the Solomon Island Demographic Health Survey 2026, and also now in pipeline is the Nutrition Environment Assessment Tool that will be used in schools, in 100 schools across Solomon Islands, and also a plan to have a dietary assessment in 2026. Another opportunity comes up with the digitization of routine data collection at the healthcare facility with the Ministry of Health and Medical Services. So these are some of the opportunities, challenges, and what UNICEF has done in the Pacific in terms of maternal and child health programs. Thank you very much.
Thank you so much, Salome. That was absolutely wonderful. I'm just leaving your details up there in case some people want to collect them. You've given us permission, I'm going to say this out loud, to share your slides afterwards. Thank you so much. Amazing. I really like the end, reflecting on those challenges and opportunities and perspective. I guess we haven't even started to touch on the impact of political tensions or how that might impact funding in the future. Jess, I would like to invite you to come on next, please. I'm going to share my screen and get all of this set up. But yes, thank you so much. And I'm looking forward to the discussion that we're going to have with these two presentations. And Jess, over to you.
Hey, thanks so much. First of all, everyone, I'm really quite sick, so I apologize if I break out into a coughing fit. I'll do my absolute best not to. But yeah, just to introduce myself, so I'm a strategic advisor for nutrition sensitive agriculture with DFAT at the moment, specifically with the climate resilient and ag development food security section. So I just, as a bit of a disclaimer, I'm not a DFATer, I'm an advisor. So what I'm going to be presenting today are my reflections on how DFAT considers dietary assessment in their programming. And I don't claim to be across absolutely everything that DFAT has or is doing in the space. But yeah, so just to emphasize, this is based on my experience as advising to the team since about 2019. So I've seen a bit, can't say it's absolutely everything. All right. First, I thought I'd talk a little bit about how DFAT even decides what they're going to be working on in different regions and countries. So DFAT does have an international development policy, or the IDP, and it's really focused on articulating that the policy is on meeting the needs of partner governments. It does specifically say it will support sustainable development broadly and the SDGs and lifting people out of poverty. And we know as nutritionists that both of those things require good nutrition, but it doesn't specifically mention nutrition. It's that high level policy doesn't go down to that kind of level. The next kind of level of policy, development policy that DFAT has is what's called a DPP, or a Development Partnership Plan. And it's this policy that's actually developed together with partner governments to align with the national priorities and needs. And so this is the space where nutrition would show up as being of priority. Interestingly, from what I've seen, nutrition isn't often in there. And I think that's because nutrition isn't often perceived to be as high as a priority as other development needs, such as basic infrastructure and education, health, and WASH. That being said, it is quite clear and comes up in 2 DPPs, specifically for Indonesia and Timor-Leste. Interestingly, for the Pacific Regional DPP, nutrition doesn't come up explicitly. It does include objectives around improving NCDs, prevention and management of, and of course we know that includes then nutrition as well, but it's not linked to reporting it against SDG 2, but specifically on SDG 3, which is more on health. Okay, so DFAT actually funds or invests in nutrition in different ways. So I would say perhaps primarily through core funding of multilateral organizations such as the World Bank, WHO, UNICEF, FAO. And with that core funding, then these agencies are left to use that money how they feel fit. And luckily, I guess for us, nutrition is a priority for many of those agencies. And so we anticipate that nutrition is worked on through those mechanisms. Then we have regional investments. For example, DFAT specifically supports SPC, so the Pacific Communities Public Health Division, which works on diet and nutrition. And then also through bilateral partnerships, and that means through specific country programs. And those partnerships are developed based on those DPPs. So if nutrition is not a priority coming out of those DPPs, then DFAT is a bit limited on how they can support bilateral programs relate to it. In DFAT, there are 2 areas with nutrition advisors. One is homed in the Global Health Division, and then there's me, who's homed within the Climate Resilient Ag Development and Food Security section. The 2 of us, we've worked over the last couple of years to put together some nutrition guidance notes, and these guidance notes are designed for DFATers, so DFAT program managers, and also the managing contractors, the implementing partners, to assist them with understanding the basic concepts around nutrition and also how to integrate these, like the overarching frameworks and theories of change, impact pathways into their programming. Both guidance notes that we have actually include reference to the importance of diet quality indicators, outcomes and indicators, and provides references to different resources for dietary assessment methods. So we have 2 nutrition guidance notes. The one that's just been released is the multi-sectoral nutrition programming note, which covers different sectors quite briefly. And then the second one, which you're probably not surprised that I developed, was the nutrition sensitive agriculture and food systems note, which goes into a little bit more detail than what's in the primary one. So I really suggest people have a look at that. It's a great tool to see how DFAT is actually, we're recognizing that nutrition is important. And so we now have these tools as well to facilitate that into programming. I would say, broadly speaking, dietary assessments are not widely used in DFAT programming. I've seen food consumption assessments used, and I use that kind of really broadly because it's not necessarily using a standardized dietary assessment methods that I think a lot of dietitians and nutritionists we would call them dietary assessment methods. Sometimes it's, did you increase your consumption of fruits or vegetables, and looking at the consumption of a specific food or a food group without looking at the overall diet which, as we know, is important to do. And I think the reason why that happens is because diet quality outcomes really are uncommon in a lot of the DFAT's development programs. Food security is more often used in the MEL frameworks and theories of change that I've seen. And I think there's different reasons as to why that happens. And we'll talk about those challenges a bit later. But I think also it's about a broader, outside of the nutrition space, there's a bit of a conceptual, health, food security and nutrition are conceptually presented and understood, that often people just lead to food security as being the outcome. then people have to report on. So from the different projects I've seen across the years, it's not to say that dietary assessments aren't used at all. So broadly speaking, national nutrition surveillance surveys are supported, like through the UN, UNICEF's child and maternal health surveys that look at child minimum adequate diet and child dietary diversity, for example. They're supported. Household income and expenditure surveys as well. And I know nutritionists generally don't like to consider economists and their tools as dietary assessment methods. That's another way that it can be done. I would say qualitative 24-hour recalls are probably the most commonly used method. I saw a lot before and during COVID. I saw the household dietary diversity score module being used very frequently. And I think a lot of people not really understanding what that outcome or what that indicator meant thought that it was about an assessment on the diet and diet quality, whereas really it's a validated indicator for food security access dimension. But over time, I've been seeing a lot more application of the individual qual 24-hour recall method to be able to collect indicators such as minimum dietary diversity score. So that's been a really nice shift to see that happening a bit more frequently. And since COVID, we've had quite a few high-frequency phone surveys that have come through the Pacific. WFP have their mobile vulnerability assessment method survey tool, which includes collecting data to present on the food consumption score for nutrition indicator. And to do so, that uses a food frequency questionnaire for over 7 days to put that together. And just on the right there are some results from the most frequent round of data collected in Tonga. So you can see how they're presenting the data there. I actually don't think DFAT is funding the current round, but we funded a lot of the early rounds from COVID till about last year. And then there's also the World Bank, who've been doing through the Pacific Observatory, collecting phone surveys on the food and security experience scale indicator, which is not a nutrition indicator. It's a food security indicator for SDG 2. And while, again, not really a classical dietary assessment, I think it can still be considered assessing the diet, but not necessarily in the way nutritionists like to think about it. And they're also now collecting as well the dietary diversity score for women indicator too. So I'll just talk about 3 programs where I think they've actually used dietary assessment methods in a really nice way. The first 2, Atoll Food Futures, which is implemented in Kiribati, Tuvalu and Fiji, and POMAC, or Farming for Prosperity in Timor-Leste. I know not necessarily Pacific, but there are brothers and sisters. Both of those programs utilized a qualitative 24-hour recall specifically to collect the NDDW indicator, both for their MEL, because they actually had diet quality as an end of program outcome, and also to help inform the program design. So for the Atoll Food Futures program, they really utilized the data from the assessment to target specific food groups that the program would focus on supporting in household production for consumption pathways. And for TOMAC, which I should also add was DFAT's first nutrition sensitive agriculture program, they used the data really effectively actually to design the second phase, and specifically in terms of targeting which value chain, like nutritious value chains they'd focus on. It was very much like a value chain driven program, so that there was more of these nutritious food groups that were underconsumed available in the market, while also supporting home production for consumption as well. And then the last one is slightly different. It's a DFAT and ACR, so that's the Australian Centre for International Ag Research funded program in Papua New Guinea. They conducted a rural household survey that used 2 different dietary assessment methods. So the household income and expenditure survey module, and then a qualitative individual 24-hour recall as well. And they've used, the image on the right, the figure on the right is an example of the calorie intake using the highest data. And they're using the data in a really effective way to help inform policy. And I've been supporting the team a little bit in this work. They've been using it to communicate effectively with the government and from various different departments as well on how to really bring together the importance of multi-sectoral engagement in nutrition in PNG. And then the second way we're using it is to update the national food security policy now. And so we're using the different dietary assessment data to guide the policy update and also to inform the implementation plan to figure out like what types of interventions are most likely to actually shift the intake of different food groups to hopefully improve the diet overall. So even though we have a couple of good case studies on when the dietary assessment methods are being used nicely, I think overall there is a broader challenging environment as to why it's not being used more. One of the big ones really, and applies to DFAT-TERS, but also the implementing partners that are contracted to implement the aid programs for DFAT, is there is generally a limited understanding about why nutrition and diet quality are important for development overall. And related to that is the different impact pathways. So they don't really understand how diet can be impacted by different development initiatives. Often diet quality is perceived as like a real nutrition health thing. And so it's not important to me. Whereas having an infrastructure project that's putting in a whole series of road networks, they don't really understand that actually that's likely to have a significant impact on diet quality because you're opening communities that before didn't have great market access. So that's a key challenge, I think. And linked to that is the capacity within the aid program to even be able to deliver on these objectives. I think even though a lot of the people in funds, and we have a great increasingly number of trained nutritionists with these skills across the Pacific, I don't think they're necessarily linked in well with the DFAT managing contractors and aid programs who are being contracted to put together design proposals to respond to different DFAT tenders and contracts. So there is that, I think, opportunity, like gap there in terms of linking the people who have the skills to the aid program. And linked to that, and perhaps I think probably the most important challenge is the policy enabling environment. Currently in the Pacific, we don't have a regional nutrition policy. National nutrition policies are either outdated or they don't exist. And where they do exist and are current, they're often really focused on stunting, and it's not necessarily a huge focus on diet quality. So until we really have the countries and regions prioritizing nutrition and diet quality, then, it's really hard for DFAT to respond to these as within their programs as well. And I think Solange touched on this as well. There's a huge challenge around at least the perception that dietary assessment methods are costly and require highly specialized skill set, which of course, if you're doing a full quantitative dietary assessment method, absolutely can be. But from a development perspective, we might not necessarily need to do that level of assessment always. So being a bit more positive, what are the opportunities? I think DFAT in investing in these nutrition guidance notes is a really great start in order to support that shift in conceptual understanding about the importance of nutrition and diet quality for development overall. And we recently, together with Tali, who is the other nutrition advisor, we held an internal DFAT learning event where we presented the guidance note and some of these perceptions, and it was very well attended, which was fantastic. It's hard to get a DFAT to pay attention for 90 minutes sometimes. So it was great to see that. And that level of interest too showed us that people are starting to go, okay, this is important. I need to understand how to include this into my programming. And I think it would be good if we could also make these learning events external facing and particularly targeting these different managing contractors. And I think also really important is that countries need to prioritize nutrition and diet quality, right? So not just in the nutrition policies, but also working with DFAT to include diet quality and nutrition in these DPPs. So making it easier for then DFAT to say, yes, we'll support a project that's looking at diet quality because it's in our DPP. And I think SPC has a huge opportunity here to be a key leverage partner in this space to advocate for the importance of this in our region. And we really do need to invest in cost-effective, easy-to-use, scalable dietary assessment methods. And I've put here an example of the Diet Quality Questionnaire, or DQQ. And I think this is a great tool that can actually tick all these boxes. It only takes 5 minutes to administer. It's already been developed or validated for 8 different Pacific countries, and most of them in the local language already as well. So it's ready to go. And you can calculate a suite of different diet quality indicators, yes, qualitative, but still globally validated indicators from this module, including the minimum dietary diversity score for women. And I think linked to that is the fact that I think 2 weeks ago, the MDDW indicator was formally adopted as an official SDG2 indicator is a huge opportunity now for the aid program to be incentivized to be working more on diet quality and nutrition, because now we can actually say, hey, we're directly supporting SDG2, for example. So I think there's a lot that can be done now that's happened. I think a lot of people in the virtual room can work on advocating for that to be included into more development programs. So I think it's good timing now. And that's it. We're done. Thank you.
Thank you so much, Jess. That was absolutely amazing as well. And so interesting to hear the overlaps in your presentation and Salome's presentation. Just, I guess, the challenges and where we started and where we've come to, the fact that we've now got an indicator for SDG 2, for that qualitative dietary component. Yeah, it's absolutely fantastic. And I'm just trying to get up my notes here so that I know what I'm doing for the next one. I do want you to hold on to your questions, folks. We have a good group here, and I would like to, first of all, share with you a link, because in our discussion groups, we're going to take a little bit of time now and really try to distill from your experiences and from the experiences that you've heard through Salome and Jess this morning. What are the key opportunities, the biggest opportunities for dietary assessment in Oceania? What role should the task force play in improving dietary assessment? And how can we work together to create a stronger regional approach? Jess, you talked about at the end there needing a regional national nutrition policy. Again, complex and diverse. Both you and Salome talked about capacity and time being an issue, and finances and logistics. And we're always hammering on those things. But I guess collectively, FONS, we want to bring people together, and that's the purpose of FONS. And I just want to reiterate for those of you who don't know about FONS, but essentially we came together through a co-design process. We decided that it's about bringing people together for the advancement of nutrition science, health and well-being in our region. And of course, our values are people at the centre of what we do. It's about knowledge and translation, family and fellowship, equity, inclusivity and transparency, and respecting and trusting to build that integrity for our region and for nutrition. What I'm going to do is break you out into breakout rooms. Enjoy the discussion and enjoy the networking opportunity. Hello, everyone. Welcome back. I think a few have had to run off, but what an absolutely amazing opportunity to get a little bit more in depth with people in the region and experts in the region as well. And happy now we've got a little bit of time for some discussions. If people have questions that they want to ask Jess, Salome, or just even bring up from the room. Sarah, I'm going to throw to you because you're the FONS president. If there's anything that you wanted to throw you under the bus.
Thanks, Tracy. I don't think there's anything specific I wanted to add, but I just scrolling through the Google Doc, it's just amazing ideas there. And I think even we just had a small group of 3 in our breakout room, and it was just so great to have those different perspectives and ideas around what we can do. And I think what's most exciting about this is we want it to be a co-designed task force designed by stakeholders across the region. And I think it's just so fantastic to see so many ideas in there. So thank you everyone for making the time and contributing.
I know, it's absolutely fantastic. This is the space where we want people to share, whether it's your first time attending something related to FONS or not. But I hope you'll keep coming back and engaging, because I could have a much longer conversation with you and with everyone on the call. And I'm just conscious that people are needing to run off. We had put 90 minutes in the calendar for this activity, but I do intend that we would have the next webinar with the speakers to be confirmed, but hopefully again, perspectives from the region and hearing the call out across the document about what people are interested in, the way forward, and taking that approach. So I will summarize the recording and I'll also summarize the Google Doc, because what we want to do is, again, take the next steps with you to create and build on the task force. There's definitely a strong need for it in our region. So everyone, thank you so much for participating today. You have been absolutely amazing and really generous in contributing your time and to hear that diversity of perspectives and reflecting on now we've got a good enough measure, we've got the minimum diet diversity score. If we look across all of the other tools that we have that are existing, how can we make sure that people are aware of those and that we do share them where they are available? So thank you so much. I'm going to say goodbye. Thanks, folks.